That's a good question. After bariatric surgery, the diet, typically what we do is that there are two different diets for the type of procedure you had. One is a gastric bypass diet, and we divide them up into stages. Stage 1 is essentially liquids and protein shakes. Stage 2 diet is sort of pureed foods or baby food consistency diets. Stage 3 diet is considered soft foods like mashed potatoes and things like that. And stage 4 diets are regular food. So for a gastric bypass patient, we advance every stage every 2 weeks. So for a gastric bypass patient, it will be 8 weeks before you're on real food again. For a lap band patient, we do the stages in terms of 1 week per stage. So that's how we do it at our practice. Now, gastric bypass patients have an issue where they cannot eat certain foods as well, like really sugary foods, which will cause what's called dumping syndrome. And dumping syndrome is a problem where the person will eat a sugar load or a really sweet load. It will go into the small intestine, which hasn't really seen sugar in that form. Typically it goes through the stomach before it goes through the small bowel. And what happens is that the sugar gets absorbed immediately and the patient releases a lot of insulin, which causes all sorts of problems because the insulin will cause the blood sugars to drop and patients will result in having sweating or palpitations, and they'll just feel awful with stomach cramps and things like that. So those things have to be avoided. Absolutely. I mean, that can happen, and it can happen for a couple of reasons. One of the reasons is gastric edema or gastric swelling, where the connections, especially for a bypass, you have a connection between the stomach and the small intestine. Now that connection determines how food flows through there. If there's swelling where those sutures are placed or the staple line is placed, that will kind of slow the process of emptying of that pouch. The same thing with the lap band patient. Sometimes they will get swelling as well where the band is placed. So occasionally they have to advance their diet slower, and that's why we use the different stages of diet.